learning how to change the way we deliver healthcare is complex and difficult. And so we've developed and are continuing to evolve a training program in implementation science, which is the basic science of improving healthcare. And then the third, which is what you're here today for, are the IQ forums. And this is an opportunity for different stakeholders in our community to share their perspectives and thoughts on different challenges and issues facing healthcare in Kansas City. And, this year we used to do these every month. We've shifted to every other month with an extra session at December to report back to the community what our opioid and heart failure transition projects are doing, as well as to hopefully launch a third project in the region, which we suspect will likely be trying to improve maternal care and maternal mortality. And today's lectures or series of sharings is addressing holes in society's safety nets. And, healthcare, it turns out, even though that's been a lot of our focus on quality improvement, only impacts about a fifth of health. And, that's what's represented by clinical care in the orange. Our physical environment accounts for about 10%, water quality, housing, et cetera. Health behaviors, smoking, drinking, exercise, et cetera, affects about 30%. But it's estimated that about 40% of health is defined by other factors, and clearly not part of healthcare itself. And, when you think about these determinants of health, there's a lot of different considerations to think about. And, from a hospital's perspective, when they think about all these things that are impacting health, they're really struck with, what do I do? I mean, it's difficult for them to be in a good position to think about building the infrastructure to address a lot of these areas that occur outside their walls. And so today's discussion is really about addressing these holes in society's safety net. And we have an extraordinary panel of people to share their experiences. Carl Wu, who's the founder and president of Artists Helping the Homeless, will start this off, followed by Janet Miles Barty, who is on the Local Investment Commission in Kansas City. We are very fortunate to have McLean Bryant Macklin talk about the Health Forward Foundation and their policy and strategic initiatives, and then Claire Hall and Monique James describing their efforts at the Wyandotte High School Bulldog Health Clinic. So at this point, I'd like to stop talking and really turn it over to our speakers to share their perspectives. And Carl Wu, you're the first up, and thank you so much for presenting today.
Aaron, can you help me put the screen up?
Am I visible?
Yeah. Okay.
Perfect. Thank you.
Thanks. Okay. My name is Carl Wu. I hope you all can hear me. I'm with Artists Helping the Homeless. So can you go next slide? And so in the past 13 years working full-time, I'm learning the struggle and the gaps in this between the service provider and how can we provide a true continuum of care. So on the people that we serve, we're finding the difficulty of finding residents that they can stay away from their old challenge life. Employment is always very hard. And then how do they get the outpatient classes? How do they deal with court issues? How do they get medications? And how do they address the legal challenges? And sometimes they can't get to the probation or parole meetings. And of course, the goal is to reconnect with the family. And how do they pay for the fines and restitution so they can move forward? If they have mental health challenge, how do they get to their counseling services? And sometimes they have to do the community service. And how do they, of course, how to stay consistent and stay clean. Those are the general challenges of each person as they try to move away from homelessness or from recovery to try to get back to a quote unquote normal life. Okay, the next one. So what I learned over the year is that we need to provide a safe and clean residential environment. And so if they don't have a safe place to live, and that means they cannot move forward. And then transportation is very, very important because my standard joke is if you live in Kansas City, Missouri, and they say, well, go get a job. And then they say, well, Amazon is hiring, they pay really well, but how do you get to Amazon? How do you get to the hours they provide the job? And of course, then if you get into trouble, where are your peer support? Where do you turn your mind and your thoughts to? The case management is also very important. And of course, the doctor's office, again, is a very challenging issue because like, if they have no insurance, how do they take care of their basic needs? Do they go to the emergency room and cost the community $2,250 per visit? Or they call an ambulance to cost another $1,000? So for the basic doctors, like you and I can call our doctor and set an appointment. The people we serve who is in the lower income would not have the opportunity, or if they're homelessness, that's not possible. Of course, we want to make sure that they get the COVID-19 vaccination during this period. We want them to go to the AANA meetings to make sure that they can continue address the substance use challenges. And then education is another thing that's really important because sometimes they say, well, you can get a Pell Grant. Pell Grant is wonderful, but if you were homeless, you're on the street, you already applied for your Pell Grant, you got a student loan, but yet you could never pay them back because you've been not moving forward. So suddenly you cannot get back to school. So we also created an education so that they can get back to school for the first semester. So while they find way to pay back this, begin to pay back their student loan or Pell Grants, and so that they can continue the education. Why do we do that? Because like if you don't do that right way while their motivation is there, they say, well, you have to wait another 8 months before you can start back. Majority of us do not wait 8 months to go to college. I will venture to ask how many of us waited 1 year to go back to school. And then of course, then we also want to make sure that they have the next step housing. It's great to have a temporary housing for them to stay, but what is the next step? Where do they go from there? How can they build the credit? And so we also make sure that we guide them through the budget. We make sure they understand the 20% is spending, 80% is saving, so that you can address all your basic expenses and challenges so that they can move forward to the next step. Get the next one. And also, there's a lot of gaps in Kansas City, Douglas County. There's the opening for Oxford houses or transitional houses are very limited. And if you have a felony charges, that you also always have problems. And also your credit history. But if you never was able to rent a place, how do you rent a place? Because you don't have the credit history, you don't have the rental history. And so that's why we create an apartment and a respite house so that they can, after the first phase, while we house them free of charge, making sure that we provide all the wraparound service to them so they can build their life. We create a second phase. The second phase is so that they can now pay a small amount of rent to build a rental history, to build their credit, so that we can say to people, yeah, they have a rental history. And also, when they are living independently, this way they can really fine-tune their life skills. So when they were, so that they can learn from when they were in the homelessness segment, they can't do that. But once they get to their own place, they can learn their life skill, and then continually support them with all the resources and the recovery. And one of the joke I always have to share is, like, I have one gentleman I work with, and things that we take for granted. So I think that's something that we all have to learn is, he was staying at our house and he was going to clean the blind above the kitchen window. He picked up the hose from the kitchen sink and sprayed the blind. In his mind, he was really doing something good because he's cleaning. But in reality, that means those are really the basic skills that we thought everybody should know. But if they were having that challenge from day one, so those are the basic skills that they don't know. So we have to not take things for granted. We have to constantly have the correct empathy for every step of their way so that they can move forward. And that's why the wraparound and all the service is really important, because a lot of times we take for these things for granted. Even like how to budget for grocery is a challenge. How to build your credit score, like if you don't have a good credit score, you could not rent a place. And so those are all very important things that we learn along the way as we provide service for the people. And so the transportation is really, really important. So how do you eliminate, my story earlier was like, okay, go get that job. How are you going to get to that job? Is the bus service 24 hours? Are you living in the area that you can get to the job that you wanted to? And so in our program, we provide transportation for everybody to go to school, go to work, to make sure that they have the opportunity to build their life from square one. And then, and we also want to, one of the things that I always try my best to emphasize is, please use your firsthand experience to give back, to give the empathy for the people that you work with. And so, and I think that, and in fact, everybody, my coworkers are all people that I work with to begin with. So when they get better, we partner with them so that they can work for us. The reason why we do that is because they have the first-hand experience, so they know what is missing, what is needed. And so this way they can get a job and then to build a job history, and then they can move forward. But yet at the same time, we are benefit because they have the correct empathy and they know what the challenges are. And so they can really work with the people that we serve. Okay, the next one. So sometimes we, in the past 13 years, we have a lot of success stories. We have a majority of people that we put in the second phase. I would say 70% of them purchased their own vehicle and they got married. In the past 5 years, we have actually have at least 5 people we serve purchase their own home. And so this is what we want to do. We want to not only support them, guide them, work with them, but we want them to thrive. My main focus always try not to have them survive. They don't need to survive, they need to thrive. That's why we provide all the wraparound services. So that in the past 5 years, I have 5 of the people we work with all bought homes. It's over $250,000. So they're from the homeless stage to become a homeowner over time, so which is really important. And then we also, the reason why we get them back into school and do education is so that they can find their own calling, what is best for them. So I have people that graduate with engineering school who is now become an engineer in an engineering firm in Kansas City. We have people that went to business school and study accountants. We have people, of course, they want to do like trades, and we will also encourage them to learn the trade that they want. So if we can take our time to guide them through, allow them to find their calling, what they want, so they will stick with that job or career that they want. So now it becomes a something that they truly want. So it's not like something that I get to a fast food place, work, and then I get tired of it. So that way they can have the career development that they needed. So those programs are really important. So we don't want it to say, okay, you go get a job and good luck. So we want to make sure they have the opportunity to build their career so that they can give back to the society. Well, thank you. I think I talked enough. So if anybody have any question, please let me know.
Thank you
That
so
was
much.
really terrific. Thank you so very much.
Great. And then we will, I guess, move to our next speaker as well. Thank you so much, Karwu. So we'll now be hearing from Janet Miles Barty, who's the Executive Vice President of the Local Investment Commission, or LINC, on public-private partnerships. And so the floor is yours.
Yes, thank you all for your time today. And I will be talking a little bit about addressing holes in the safety nets and some of the things that we did, especially when COVID was at its highest, and some of the things that we did in the community to support and address holes in safety nets. So first of all, again, I'm Janet Miles Barty, Executive President of Local Investment Commission, Greater Kansas City LINC. So we can go to the next slide. Just a little bit briefly about what we do, Local Investment Commission. One of the things that we're most known for is our caring community sites. We're in 6 school districts, 2 charter schools, and 52 sites. And in these sites, we have what we call caring communities. And one of the resources in the caring community in these sites is the before and after school program. And the before and after school program is important to the caring community sites because the before and after school program allows us to meet the children and families where they are, to support the children and families. We do many things in those caring community sites. First of all, it is our goal to serve the whole child. And in order to serve the whole child, we first have to serve the whole family. And so whatever those needs are for the child to be successful, that is the work that we do. And it could be that mom needs a job or they need utility assistance. So it is our goal in our programs to serve the whole child. Want to talk a little bit about the community crisis, March 2020, and the threats on caring communities. When COVID happened and we were used to operating inside of school buildings, you know, one of the first conversations I had with our president is, okay, this will prove, you know, the need for LINC in the community. And I am here to say during this time and even to this day, our work doubled. So one of the things that we were most concerned about was isolation. Lack of awareness and access to vaccinations. And I'm going to stop with that one. A lot of families in the communities we serve really did not have access to vaccinations. And a lot of times when I meet people, they say, Local Investment Commission, what do you do? And one of my first responses so often is that when I wake up in the morning, the work that I do depends on what's going on in the communities and neighborhoods. And one of the things that we look at, you know, every week, no matter what is happening in the community, no matter what's happening in the neighborhood, it touches some child in our sites or in the schools. So when COVID came and vaccinations and awareness and access to vaccinations came about, we had families that were contacting us and saying, you know, we want to be vaccinated. We're scared of dying, but we cannot navigate the systems. And so immediately we contacted the governor's office and saying, you know, how do we support the community? How do we make sure that the people in the community that have no access are able to get the vaccine? And I'm talking about the person on the bus stop that's homeless. I'm talking about the senior who does not have a computer or a phone to navigate, to make appointments. So we ended up setting up a small vaccination clinic. And by doing this, we did almost 26,000 vaccinations out of our partners facility, Morningstar Youth and Family Life Center. And we partnered with Morningstar, and we partnered with the National Guards. We partnered with the governor's office, University Health, the Kansas City Fire Department, and we went to work. And so we were able to disperse some of the fear around COVID. Another thing that really was a divide in the community during this time was digital divide in schools. And so a lot of times the children who were in schools, and then they dispersed them out into the communities and back at home to be able to have education online. Well, we were finding out that so many of the children where we serve did not even have access. And so they didn't have a computer at home, you know, they didn't have Google or Spectrum, or so we went into those homes, we went door by door, and we worked with those families so they were children were able to be educated from home. This picture that you're looking at now, during this time, families were losing their jobs, and so they weren't able to pay their utilities. We had so many families who were being evicted, weren't able to pay their utilities. So we started looking for resources in the community where we were able to support those families in order that those children would have access, they would have lights, water, gas, and the things that they needed to be successful. And that goes back to the village supporting that whole child. And so before this happened, I could have never imagined the work that we would have been doing during this time. Today, we have done almost $3 million in utility and rental assistance. And these are to families who would otherwise have been evicted or not have the access they needed during this time. Another thing that's huge in the work that we did to try to really close the gap was food assistance. And during this time, and even now, this is a recent picture of last week's food distribution. Families really struggled to get food. And so we were there 3-4 times a week, making sure that when families drove up or when families contacted us, we were able to support them with food. We've done over 5 million pounds over the last few years. And so to think about serving 75,000 households in meals, you know, it's just been amazing to offer that kind of support. And I am so grateful for our community partners who jumped in when we called and said, hey, the need is high. And so these were things, you know, families were doing everything, you know, the home became a school. So they were not serving one meal, they were serving 3 meals. And so we were there to support the families through the food desert, and families were so grateful. Another thing that we did to really work during this time was just being a listening ear. We made sure that families knew that they could contact us, they could talk to us about the need was. We had a lot of families that had some domestic issues during this time. We were there to support them in their court cases. We had legal aid supporting them. And this goes back to our philosophy. Children cannot succeed unless they have the village around them and you're supporting the whole child. So these were ways that Link really worked to lessen the gap during this time. We did creative and aggressive love. You know, we went by households, we called, we did crisis intervention, problem solving. You know, there was a huge language barrier in some of the needs that were happening during this time, especially the vaccination. So we worked with different organizations to help lessen the language barrier, just got out tons of resources. We worked with social media to make sure that families knew where those resources were. And then we did things as small as still creating chess teams online so children had social connections. We did recreation activities. We made sure that we were going door to door, giving out books to children so they were not getting far behind in their learning. But what was most important during this time, we worked hard to strengthen the partnerships that we already had. Does anyone have any questions for me?
This is an amazing effort and program. how many, families did you touch last year, and how do you support this, incredible outreach and program?
So we work with partners around the city, and we also have a blended funding, but we touched over 75,000 families. And what has been so helpful during this time, when superintendents of the schools were so fearful that children were going to be bounced around from school to school and district to district, we were able to work with those school districts and target those families and take care of the needs that the families had. So they were able to stay in the same houses, they were able to stay in the same school districts, so the children had those familiarities.
And when, sort of the prohibition of evictions passed during COVID, did you see a huge impact here in Kansas City and in our community?
Yes, we did. And, even till today, as I work with school districts, there are still children who we have noticed who moved to other places outside of Kansas City. When they first went back to school in person, there was a real concern that, where they were missing students. So yes, there were a lot of families who relocated due to eviction.
Thank you so much for sharing your experiences. I'm just really blown away. So
Thank you so much.
yeah, the next speaker will be Bryant Macklin, talking about philanthropic and policy perspective, the needs for more diverse and culturally competent health sciences workforce.
Good afternoon, everyone. I want to apologize in advance. It appears like my signal is unstable. And so if I cut out, Pat, just wanted to give you a heads up.
And so sound great now. So
okay, well, I will keep going.
McLean, if you can hear me, you did cut out.
Okay.
Oh, there you are. There you are.
Okay. All right. Just saying, I'm going to go a little light on Health Forward and really deep on an issue that I wanted to raise everyone's awareness on. It's an issue related to another issue. I guess the primary issue being the need for more diversity in the health sciences, and then a bill.
We're losing you, McLean. McLean, we've lost you. I don't know if you can hear us.
It might help to turn your video off just to save some of the bandwidth as well, if you can hear us, McLean.
I'll put that in the chat for her to see if she can hear it. Oh, maybe McLean is signing out and coming back in. Did I just see her leave? Everyone, bear with us just a moment. I think McLean might be trying to sign out and sign back in. There we are. McLean, can you hear me?
I can, and I just foresee this is going to continue to happen because it happened twice.
So maybe if you turn your camera off, it'll save some of your bandwidth.
Let's try that. Okay. All right, I'm going to share screen again and then plow through. Can you still hear me?
Yes.
Okay. All right, so McLean Bryant Macklin, I'm the Vice President of Policy and Impact at Health Forward. I hope you all have heard about us. If you haven't, we are a public health conversion foundation that was formed through the sale of Health Midwest to HCA. It's a common story. There are many foundations like us that were created through these transactions. The proceeds of the sale fund in perpetuity our great making, advocacy, and leadership. And those resources come with a charge, and our charge is to allocate those resources to the communities and people that we serve to meet community needs and to really work toward providing greater access to safe, quality, and affordable healthcare. I've got our service area here in the picture so that you can see that we work on both sides of the state line in the counties that you see in the dark blue. Our ethos, our mission, our mantra is that every day we work to support and build inclusive, powerful, and healthy communities characterized by racial equity and economically just systems. So who do we do it for? We have spent the last years and change refining our work, and that includes our communities of focus. We are refocused on folks who may not have been in the focus historically and the design. We are focused on those who have not had the financial resources to bring to bear. And because of this, they experience inequities, disparities, and injustices in health. And these include people of color and people residing in rural areas. So our work to refine ourselves resulted in our new purpose and our new purpose plan for acting out that purpose. We now have 4 primary purpose areas: platform, people, power, and place, where we're centering our work going forward. So I'll give you a second to peruse this for those who haven't seen it. I feel like everyone's seen it at this point because we have been all over the place sharing this information, because it's a new situation for us and grantees that we worked with for a long time. So we want to be really clear about our intentions going forward. And I've highlighted here the work in our people purpose area, because that is where we are honing in on the need for greater diversity within the health sciences workforce. So as you can see, this is something I'm just here to talk about. It's something that Health Forward is very much committed to. You might be asking yourselves, why? Why is this a problem? Why is this happening? What is the harm, and what can we do? So just to recenter around the overarching topic of the day, there are many social determinants of health, and we call them social influencers because they don't determine our health, but they do influence our health, of which the quality of and access to our healthcare system is just one. This slide shows that access to care and quality of care accounts for 20% of our health outcomes.
McLean, if you're talking, we can't hear you.
The problem lies herein.
There you are.
Oh, shoot.
You're there.
Okay. Okay. I don't know how long I was out.
You're out.
Am I still sharing screen or not?
You're not sharing screen, but I
Okay.
hear you.
Okay, something happened. If I can share my slides with you and we can share them out, but I'll keep going until you tell me to stop.
Okay.
All right, so circling back to this slide, it shows that access to care and quality of care account for 20% of our health outcomes, but it also shows that another 30% of our health outcomes are attributed to our health behaviors. And while our health behaviors and our health care or access thereto are listed separately, they're really related and co-joined, because our healthcare providers, if they care and if they are culturally competent, should understand and counsel and help us to address our health behaviors, which will then affect and should improve our health outcomes. And the problem lies in the fact that oftentimes health providers don't understand this. So I'm hoping that you all are still with me and that we're now asking ourselves, more of the why. and have gotten more curious because this is a problem that is deep and pervasive and complicated. And it's a problem that has plagued health for generations and one that is particularly prevalent in modern and accepted medicine. And it is at the root of the health disparities that are experienced by people of color. But the gleaming light of hope is that it's solvable. So to put it plainly, it's a matter of life and death, that we have more diverse people in the variety of health professions. We have squared in on diversifying the health sciences pipeline because it advances our purpose, and greater diversity among those in the health and medical professions will not only help to reduce the health disparities and injustices experienced by people of color, it will also increase economic opportunities in these communities. So I'm a lawyer by trade, so this is where I make my case. And as any good lawyer has been trained to say and show, there is an abundance of evidence to support my case. This slide shows some of the findings of the Commonwealth Fund, which has reviewed a lot of studies research on the disparities that exist between people of color and their health outcomes and the health outcomes of white people. And over again, holding for age and holding for education, and even in the same hospitals, Black and Hispanic Americans have worse health outcomes. I've included some examples here for you to peruse. Black and Hispanic people die from cancer at higher rates, due at least in part to disparities in care quality and barriers to access to high quality care. Black people are more likely to experience subpar breast cancer treatment, due at least in part to deviations from standard clinical guidelines and treatment disparities. Black and Latino people rates of treatment for diabetes is lower, and they are less likely to receive early intervention services. Black people with diabetes are more likely to have a limb amputated and less likely to be offered limb-saving procedures or receive early intervention services. Black women are dying during or soon after childbirth.
McLean? McLean, you're quiet. McLean, if you can hear me, you're quiet. There you are.
Okay.
We
All right.
heard,
Well,
we heard you,
I'll
heard you
give you all a
discuss
second to just peruse
amputation.
this slide. Can you hear me?
Uh-huh.
Okay, to peruse this slide, it's just some factoids and data points on the disparities, the very glaring disparities that exist between communities of color and the white community in terms of health outcomes when holding for race, age, even occurring within the same hospital, to demonstrate the need for culturally competent and other important fact to point out is that while population levels of racial minorities, which now make up about 40% of the population, will continue to grow, that diversity in the health science professions isn't showing any signs of getting better based on enrollment numbers in health sciences related programs.
McLean, we can't hear you, but we can see the slide. So
So
I
you still
imagine
can't hear me?
Well, I hear you now, but the slide was there, so we were taking in the slide, but we couldn't hear
Okay.
you for a minute.
Okay, great. And so this is just to show the underrepresentation of African Americans and Latinos in the health professions currently. As I said on the previous slide, there's no real signs of this changing on its own, even with population growth amongst minorities in the overall population of the country. The enrollment numbers in programs, higher educational programs for the health professions are actually declining for minorities.
We're not hearing you now. We heard declining for minorities. McLean.
I'm here. I'm just waiting. I was just waiting on y'all. All right, I'm gonna go to the next slide, assuming you guys had time to read that one on your own.
Okay.
All right, so here, just attempting to bring it all together. There's data that shows the diversity in the health professions improves outcome. There's a recent paper from Sanford Social Innovation Review that provides a lot of good information, and I'll read. Research shows that patients that share accept more preventative treatment, show better awareness of their medical risks, and adhere more closely to their doctor's instructions. Research also documents a 15% reduction in inpatient mortality when Black patients are paired with Black doctors. It also shows a 19% reduction in Black-white mortality gap for cardiovascular care with a patient and physician race match. There's also another study from Stanford University that found that Black men were more likely to talk about their health concerns with a Black doctor, and another study that found that Hispanic people in the United States delay going to the doctor because they do not understand the healthcare system. The economic opportunity sign of this is that you can earn a nice living in the health sciences. Many of these positions are well paid, providing peace of mind and good quality of life and the opportunity to save or pay for the education of your
McLean, you've been gone for a bit.
Access to financial aid or the reliance on your parents' credit in order to qualify for financial aid. Families not earning competitive wages to repay loans or even qualify for the loans. Or upon graduation, there's no guarantee that you will earn a competitive wage because of wage discrepancies amongst races and genders. Or the parents don't own a home from which they can pull out money to pay for tuition or pay for Princeton or Kaplan Review or tutors, nor are there many Black or brown people in positions. All right, so now that we've read all the doom and gloom, what can we do? First and foremost, with any issue, be aware. I think it's important to continue to be curious, but there are also opportunities to take action. And we at Health Forward are, just like the kids say, all about that action. We're a bit unique amongst foundations in our willingness to advocate and lobby. That's another innovation I can call to light, is that there's a lot of opportunity for foundations and philanthropy to occupy this space. Many foundations across the country focus almost exclusively on grant making and forgo lobbying and advocacy due to real concerns about either maintaining their nonprofit status or just fear about interacting with legislators in this way and in the unknown and what the repercussions might be. But many of us are legally able, and at Health Forward, we're really willing to lean in, understanding that both our grant making and our advocacy work are necessary for the systems changes that will be needed to ensure that diverse and culturally competent care is available and to advance policy priorities. Interpret or misunderstand what they submitted, and crafted a community-informed policy agenda that reflects the needs and interests of the folks that we serve. We understand that we're well-resourced. We understand that we have a lot of money behind us and can afford lobbyists. And so we're willing to step in and speak on behalf of our partners, as well as to fund their advocacy activities as well. And so this slide here is as they relate to our people policy area, which I've included that purpose plan here again, just so you can make the connection. And our policy priority around improving diversity in the health sciences is the one that's highlighted there, to ensure that we provide care by culturally responsive, diverse, and an anti-racist healthcare workforce. So there is legislation pending in Missouri right now. It's entitled the Do No Harm Act. There is a House and Senate companion. And if there was ever an oxymoron of a bill compared to its title and what it actually does, this is it. So this bill would essentially put academic institutions and health providers at risk of losing their government funding if they train or provide culturally competent care. Bring about greater equity, and this bill is really an assault to that. Am I frozen again?
No, I hear you now.
Okay, great. There's risk that this legislation could get some real traction. This bill would also prevent hospitals and clinic administrators from beefing up their efforts to recruit diverse candidates or retain diverse employees. It's hugely problematic for the health of minority populations for whom the data shows, again, this is an issue of life or death. But there are also opportunities that exist for moving in the right direction, but their effectiveness turns not only on their
Losing you some, McLean. We've lost you for a while now, McLean. McLean? McLean, we cannot hear you. McLean? McLean, we cannot hear you. Okay. Maybe when McLean comes back on, we have her answer the question in the chat, and then go to our next speaker, but I'm gonna see if she's gonna come back on and we can.
you want me to come back on and tell me
Yeah.
that
Oh, there you are.
I'm here?
There you are. So, so are you close to a point
I'm
where you're
done.
able to wrap up? And then,
Yeah.
okay, I was gonna say that maybe you could, somebody has a question for you in the chat.
I
So, well, for one thing, what I heard you saying was that.
don't have the
aside from-
chat because it's been disconnecting me
right.
and reconnecting me.
That's right. I'll read it to you. But one thing I was hearing you say is that, yes, we do have many holes in our safety nets, but we've got holes in our system that we need to address. And you gave everyone plenty of food for thought as it relates to the research in the Commonwealth report. Look for the holes in that work too. Look for where the safety nets are needed in some of that work. That's what I was hearing. That what you presented was fantastic. You have a question here that says, what is Health Forward funding regarding pipeline scholarships?
So we are not currently funding scholarships yet. We are currently doing a landscape assessment of the needs and opportunities for better diversifying.
Okay, you broke up. You broke up, McLean. We heard diversify. McLean, we've lost you. We can't hear a thing. Maybe, oh, you can't put it in the chat. McLean, I am going to have us talk to our next speakers because I can't tell if you can hear me. And then if you get back on, we can circle back in the end and get some more questions answered. So Claire Hall and Monique James are co-directors of Wyandotte High School Bulldog Health Clinic. Can you hear me? Claire and Monique, are you there? All right. I'm sure McLean will come back and in the end, we can get some questions answered there, but the screen is yours. Thank you so much for joining us. We're glad you're here and eager to hear about Bulldog and how you serve as a safety net or filling the holes in our safety net, not the safety net, but picking up where safety nets aren't.
All right, so hopefully everyone can see my screen. Just to give you a little bit of history about us, Monique and I work at Wyandotte High School in Kansas City, Kansas. We serve about 2,000 students who are free and reduced lunch, what you would classify as underprivileged students. Okay, so in 2011, those lovely stats were released and they showed that Wyandotte County was one of the most unhealthy counties in the entire nation. And in Wyandotte County, as many of you know, we have KU Medical Center. So KU Med Center reached out to Wyandotte High School and other community health organizations in KCK and said, let's create a safety net clinic at a high school. We were lucky enough to be the high school that was chosen. And really what we worked to address was student attendance. Health was identified as a huge barrier for student attendance and thus student achievement. Our graduation rate at the time was around 45%. It's now almost 90% because of this clinic. The clinic provides our students with on-site medical and mental health, as well as physical therapy, health department, access, places that they wouldn't normally be able to go to or navigate. They struggle with health literacy, self-advocacy, efficacy, things like that. It started really with vaccinations and physicals and has since grown to encompass all of these wonderful services that our students and their families need. The big thing that we've noticed with Bulldog is that it has really become a partnership between the school, KU Medical Center, the Wyandotte County Health Department, and then the KU Allied Sciences program. Yeah. And this partnership goes two ways. I'm going to let my counterpart Monique talk about how the clinic doesn't only just serve kids' health needs, but it serves as an internship for our students.
All right. Hello, everyone. So with that, the students that are within Bulldog, they are a part of our healthcare capstone class. And so within that class, they are actually learning learning how to take vitals. They're also learning how to communicate with the patients, being students that they may know or students they may not truly know yet, of how do you go about taking someone's information. We have at times where students translate due to the amount of languages we have within our district, let alone in our building. And so students are actually taking blood pressure. They are checking the students in. We have students actually grabbing who is on clinic that day from their classrooms. They are then actually administering the mental health surveys that we are giving. We are currently giving 2 and actually started this last clinic we had on Wednesday. Students are actually scoring the mental health surveys to help that with the doctors before they actually take the patient in. They're getting height, they're getting weight, and they're also being able to talk with the med students, the doctors that are there running clinic, as well as the physical therapists and the health department that we have as a part of. This is built within our capstone class because the students are not just getting that intern time. They're also, when they are in the classroom with myself every day for a semester, we are learning those employability skills. We are also learning those transferable skills. We are prepping for what they need for resume. How do they actually network within? So we allow them to get these ground bases within the classroom and then have the opportunity to showcase some of those skills within our Wednesday Bulldog that we operate every Wednesday at our school during that time. As you can see there, this is actually a flyer, we have a trifold that the students actually created, which allows you to see some of the services that we provide within our clinic on Wednesdays.
So like Monique said, our students use Bulldog as both a service and as an internship. One thing that we've noticed is that it hasn't made just a difference with the students in our school, but also with the healthcare providers and the KU medical students. So our local healthcare providers are able to follow up with students weekly and give them that continuity of care that they would not normally have access to if they were to go out into the community to see a service provider. A big one is the health department comes weekly. And we do unfortunately have a high number of students who use them for prenatal care. Without this weekly clinic, those students would not follow through on prenatal care, would not receive adequate care, and would struggle to navigate the system. We've also noticed that KU has used us as an internship and a practice tool for their medical students and their physical therapy students. And that's been wonderful because it has given them the opportunity to see what it's like to treat a different population than maybe those that would be able to go to KU Med Center to receive treatment. We as well use them as partners and mentors for our students who are interested in the health careers pathways.
Within that, we've also seen that when someone actually comes into clinic, if there is we have a referral process. So if they need to see someone next, whether that is for additional care, we do have a connection with Vibrant Health, which, as you can see there, it shows Dr. Joseph Lemaster. He is with KU Med as well as with Vibrant Health as well. So we now have a connection where our students, if they are not that way able to go to KU, because there is a Vibrant Health location within 10 blocks of our school, students are able to, or families can follow up with them, and we have a direct line where they can continue on care. And Vibrant also offers which happened within the last couple of years, they offer dental as well. So we're not just getting the health concept of what's going on with your body, we're also helping with oral care as well with some of these referrals. And so all of this is happening just by us having our clinic on Wednesdays with the community partners. What we actually aspire to be, as you can see there, we operate right now on Wednesdays only, and we run from 9 o'clock to about 11:30, which is during our FA time, which is considered for our district student support, and we run through their 5th hour. That is a day that we get out early. And so we've seen, like Claire said, more student attendance on Wednesday when we normally get out at 12:20. We see an increase in students coming on Wednesdays because they know that on Wednesday they can come and get care if anything's going on, if anything's happening. We actually aspire, instead of doing a half day, that we can, whether it's a Wednesday or another day, that we can actually operate, hopefully, a full day. Because with the half day, depending on how many students are being seen, sometimes we're only able to see 7 or maybe 5, and then that kind of shifts where we have to roll kids on to the following week. We also aspire that as the students are in my capstone class and being Bulldog interns, that one day that they could actually get that internship hours outside of just being in our building. We are seeing that trying to get that connection for our student, which is primarily Hispanic and African Americans, to get that chance to see what it is like to be a healthcare provider in their field, because they do not see providers that look like them, talk like them, or even from their own county, born and raised, going to a USD 500 school, actually treating them or a part of that health network. We're trying to get where they can see, not just inside clinic, but in an outside space, having those clinic hours to get a chance to learn more, to hopefully push their drive in wanting to go and continuing in that field.
So before we wrap up, since we started in 2011, we have, and KU, makes us track data, and we as well keep our own data, have seen a drastic increase in student health, which we measured through attendance rates, mental health surveys, graduation rates, self-advocacy surveys, and then our district tracks it with the mental health and social workers. So this clinic really means a lot to us, and it's something that I wish other underprivileged schools could develop or would put within their district. So thank you for letting us talk about it with you guys today.
Thank you so much. Any questions?
Thank you so much. Thank you. Thank you all for being on here. Let's see in the chat if we have questions for you. Everyone, and drop it in the chat or come off mute to ask your questions. We had great conversation from Karwu and McLean and Jeanette Miles Barty.
So there
And
are
Mrs.
two
James
questions
and
in the chat. Washington and Harmon High School are part of USD 500, and they have expressed interest. One initiative at our district office is to get a clinic in each of the high schools. We are trying to be more equitable. The barrier that we face is getting enough physician and medical volunteers to be able to go to the different high schools. So there has been talk in the past about hosting the clinic at a neutral site. I'm not sure where they are on that right now, but I know they are trying to work on that. As far as care for families, at this time, we don't offer that. I would love if we did, because especially in our Hispanic families, we see the health literacy is such an issue, and our students are acting as translators for their parents. They're missing school to do that. And if we could offer a one-stop shop at the school, a place where the parents, families, other students in the district feel comfortable coming, that we could offer them the care that they need and be consistent with that care. Physical therapy. We do have nursing students. Before COVID, we were actually a very vibrant clinic. And since COVID, we have kind of had to take a step back. A lot of that has been because of the healthcare provider requirements at KU. But we did have nursing students from KU Med. We had nursing students from Donnelly College that were coming over. And then we had nursing students who were trying to obtain their masters and go into different specialties that were coming over. Children's Mercy also works with us. They provide all of our athletic training. And we're working with getting our sports med students into internships with them. We have not had any privacy issues helping students because Dr. Lemaster and Dr. Greiner are our two physicians from KU Med that really got this started. And they ensured that all of our student interns on our end were HIPAA certified. We've also made sure that their role is limited enough that they don't have access to student information as far as diagnostics, treatment, things like that. And they definitely don't have any access to the health department with the STI, prenatal, any of that care.
And one of the questions that's on there, it was further up, it asks about, are we providing telehealth? Currently, we are not, but that would be an interesting component of thinking of moving forward.
We used to. Again, COVID has really limited us. The physician who was leading our telehealth has been pulled in a different direction post-COVID and has not been able to provide us that service at this time. So I'm hoping that we get back to what we were, but we'll see. Post-COVID world's a little different for all of us.
And then, thank you both, to both of you on this. And then I think there was another question that, apologize if you did address this one, but Joe Robertson with Link had asked about the care unit. So, as we've talked here about the family and individuals, how is yours designed? Is it specific to the students only, or does this also assist families?
Yeah, and I kind of addressed it, but unfortunately, we only provide care to our students currently. It's during the school day. There's some limitations with having families come into the school at different times. So we're stuck with our kids right now.
Okay, and then I'm looking, do we have McLean back?
No, McLean
No. Okay, there
sent
were
me
some
an email saying that she is just so sorry that everything's become so unstable with her technology today. But I just love what I'm hearing about, we do have safety nets and we have really, really strong safety nets throughout Kansas City. But what all of the organizations here are doing is stepping in when people can't get to for people who can't get to those safety nets, who don't have access to those safety nets. And it's been wonderful hearing all that you all are doing. Wu, did I hear you say that someone went from homeless to engineer? Did you say
Yes.
that? That's amazing. That
Yeah.
is just remarkable. That is
Yeah.
remarkable.
I mean, for me to have 5 people bought houses over $250,000 within the last 3 years, that is nuts to me.
Yeah, wow. Wow. Do we have more questions?
Yeah, we'd certainly welcome anyone to come off mute and join in the discussion, ask any questions you have of any speakers, or if any of the speakers have connections they want to make to any of the other speakers or questions, certainly welcome those as well. I saw a very easy to answer question in the chat for someone at Lake, just curious how many, people and families were being served, in the last year, to get an understanding of the impact.
Yes, we probably have served over 75,000 families.
Wow.
Yeah, I want to also say we work with 2,000 people a year, and our little organization actually house 200 people every year. And we also, during COVID 2020, we actually added an extra program. That program, during the 11 months, we housed 195 people from the hospital. That means we opened up 195 hospital beds during that period. So I think we all try to be as flexible as possible to kind of accommodate the constantly changing needs.
Wow, that's very impressive. And then I know McLean can't speak to these, but I know, being also a little bit of a policy wonk, I would just, really encourage anyone who is a Missouri resident, to write to the legislators specifically about 489 and 410 to kind of state, your knowledge and opinions and do some advocacy. I think that's one thing that, we can do is at an individual level that often we don't think to, but can be something that does help. And then there's also conversation that has been going on in the chat just about pipeline programs to help kind of address both what some of McLean had brought up through Health Forward, but also what kind of came through as, a need, I think, from everyone, and speaking about how we can develop these programs at a younger age, through school, so that we can best recruit and equip people with these needs and attract more diverse populations. And I would just, welcome anyone to speak about, their experience, their knowledge of some of these other pipeline programs, so we can all be aware and help make those connections.
I don't know about pipeline programs, but as somebody who works in a high school, Monique and I would love any partnerships, access to your program, student internships, all of that. We have wonderful students who we have over 500 in our health academy who want to pursue a career in the health field. And they end up graduating and they are limited by financial constraints or a lack of family support or just a lack of understanding of the system and where they go, what their next step is. So mentorships, internships, shadowing, guest speakers, all of it, we welcome it, and we would love to develop partnerships with any of you.
Question in the chat, how are you tracking individuals and students and households, families in their progress? That could be a question for all on the line. Anyone care to answer that? Are you able to track your students or households in the progress? Or attitudes and behaviors? Are you able to do any tracking at all?
So if it's directed at us, yes, we track everything. The state even requires us to track students post-graduation and what they're doing and if they've used their course knowledge, their healthcare knowledge to pursue a healthcare career. And we use different surveys and things to track that. We've also tracked throughout our years with the clinic, different successes, how many students are served. You know, we screened in the last couple of years over 600 students and serviced over 400 for mental health issues, which has been a huge issue in our community, the trauma, PTSD, things like that from the amount of violence that our kids are exposed to. So we are constantly tracking if that was directed at us.
Wu, is Artists Helping the Homeless able to do any tracking?
Yes, we do. We actually track everybody we serve. We monitor the growth and what they do. So we do have a tracking system, tracking how many people we serve, what their progresses are. The progress are mostly the people we house. So we house average of 200 people a year. So those are the people that we track more. The people we serve, we can't track everybody, but the people we house, we do.
Uh-huh. And Janet, if you're still on, or Joe, I'm trying to spot Janet. I imagine Caring Communities does some pretty robust tracking. Is Janet still with us? Or Joe?
No, I don't think so. Yeah, and I can't answer specifically except to say yes, of course we do, but I can't shed light on that. I'm sorry.
Yeah, I imagine Caring Communities does do some pretty robust.
I mean, we're all operating
tracking.
with state contracts, so we're always responsible to that. So
Absolutely, right. Okay. Well, I guess if there are no more questions, we can wrap up. I want to thank all of our presenters. You've been fantastic. Thanks so much for joining us today, for making the time. Thank you for saying yes. These forums are so important for idea sharing, networking, highlighting things that are happening in our community that not all of us get to see or get to know about, and gives us opportunities to rethink how we work. So thank you all so much. Stacy, do you have anything you want to share?
No, I think you summarized that really well. Thank you everyone so much for your time, as always, and have a great rest of the week.